A biopsy may be recommended by your doctor if they think you might have cancer. The doctor will take a small amount of tissue from the area of the body where cancer may be present and send it to a lab to be examined under a microscope for cancer cells by a specialist called a pathologist. There are different types of biopsies that can be performed by your doctor, and they will review which method will be performed for you, how to prepare, and next steps to explain the results. So, what are the different types of biopsies? Needle biopsies are done by using a special needle to collect cells to test an area for cancer. For instance, in a fine needle aspiration, or FNA biopsy, the doctor inserts a very thin, hollow needle through the skin to collect a sample of cells and sometimes fluid for examination. As this is the simplest type of biopsy, your doctor can collect multiple or large samples from the same biopsy site with this method. Image-guided biopsy uses imaging equipment to assist your doctor take the sample with the aid of imaging equipment such as ultrasound, fluoroscopy, computed tomography, CT scan, X-ray, and magnetic resonance imaging, MRI scan. Needle biopsies, such as a core needle biopsy and vacuum-assisted biopsy, can be facilitated with imaging equipment if needed. Surgical or excisional biopsy is performed to remove the tissue your doctor thinks may be cancer. The surgeon makes an incision into the skin to remove the suspicious tissue to be examined by a pathologist. Other examples of biopsy include a shave biopsy, where the doctor removes a sample of tissue by scraping the surface of the skin, and a punch biopsy, where the doctor uses a small circular instrument to punch through the surface of the skin and take a sample of tissue from below the skin's surface. Getting your biopsy results. It's important to ask your doctor before the biopsy takes place when and how you will receive your biopsy results, how long it will take to receive your results, and this can vary based on how many tests are needed for the sample and who will reach back out to discuss the results with you. Sometimes this will be the doctor or a nurse on their medical team.